Hola, hello. Good morning, good afternoon, everywhere. I will repeat everything. So we have this patient of 72 years old male. This patient have pancreatic mass, solid pancreatic tumor, and is 3.29 centimeters by 3.3 centimeters of diameter. So there is a portal invasion here also, and there are some branch of the gastroduodenal artery here. So this patient, by the surgeons, is not a candidate for surgery for the moment. So now we will show you a palliative treatment that is radiofrequency. The idea is to show you a little bit how it works. So we are using the Taiwan radiofrequency. Uh, this is a needle that we pass inside the tumor, and we have to try to go to all the parts of the tumor, and the idea is to change this hypoechogenic mass that we see here in a hyperechogenic mass after the treatment. So that is what we'll do today. After that, the patient will start a treatment by chemotherapy. So now we are in a good position, and we have our needle out. You can see here. So my needle is in the distal part of the tumor, and I will start. Ya, ya voy a empezar. So these have water for to perform diminish the temperature of the needle. So as you can see here, look. So this area that we apply the radiofrequency, so we use 35 watts. We can use from 35 watts to 50 watts of power to do the radiofrequency. You can see here, very good. So we had an ablation, a very good ablation here in this area. So now I will change the position of the needle, and the idea is to go in a lot of areas of the pancreas, of the pancreatic mass. So I change the position now. You see my needle is in another position. This was my first position of this area, and now I am in this area. So now I advance my needle. I am in a very good position again, and I will start. So you will see how it becomes white here. Very good ablation. You can see here. When to stop when you see the tissue becomes white. It shows that there was destruction by the radiofrequency. So now I start always from the distal part to the proximal part of the tumor, and the idea is to have a funny technique to have a destruction. So now I am very good here. You see the wideness of the tissue becomes until here, and now I will go to this area. So as you see, I start from this area, from my right to my left. So now I will start to do my radiofrequency here. Very good. You see, I don't move my needle. Now I am moving my needle because I start from the distal part to the proximal part. And I don't need to retire my needle. I just need to move my needle. That's why it's better to start from the distal part to the proximal part. Very good ablation, you see? So I have a good ablation from this area, complete ablation. You have to control a little bit that the wideness don't go to the wall, because you can have a perforation also as a complication, and you can have also a bleeding as a complication of the radiofrequency use. So now I'm going to do this part. So I have my needle here. I will start here, you can see. So I try to cover the whole tumor. You see? Now very well, huh? Very well. Okay. So now I think we have just few parts to be treated. So now I think I finish, huh? So you see here, this is the result. This was my mass. Here. Now becomes white. This is the whole area, so it's very easy to use this technology and to apply this. We have a protocol now going on inside the institution, and we are looking as result that some of the patients with pancreatic, solid pancreatic mass as adenocarcinoma have a good response, and it means at least 50% of tumor reduction after follow-up in mean 1.5 sessions. So thank you so much. Gracias. Vamos a cerrar la transmisión.